Planning for strategic communication. In this video, we will describe the P process, an evidence-based approach to strategic communication planning in support of tobacco control. What is strategic communication? Strategic communication is the purposeful use of communication interventions by organizations to fulfill their stated mission and objectives. There are a range of approaches to strategic communication, but there is one particular model that has been tried and tested, especially in public health. It's called the P process. First developed in 1982, with subsequent revisions in 2003 and 2013, the P process is a step-by-step approach to developing and implementing evidence-based and participatory strategic communication programs for public health. Fundamental to the P process is the selection of an appropriate theoretical model for behavior change, meaningful stakeholder participation, and continuous capacity strengthening. These can guide program design, foster ownership among partners, and ensure the sustainability of programs and interventions. The P process has 5 steps. Step 1. Inquire. Why do we need to communicate? Step 2. Strategic design. How will we communicate? Step 3. Create and test. What are we communicating? Step 4. Mobilize and monitor. Are we communicating effectively? And Step 5. Evaluate and evolve. Where do we go from here? Each step builds on the outcomes of the preceding step and is anchored by key activities. The first step, inquire. This first step consists of a thorough analysis of the situation. This includes a description of the underlying problem, its causes and possible solutions, as well as a clear articulation of the objective or result targeted by the communication intervention. This step helps us understand the problem, the target audience segments, the factors likely to facilitate or hinder behavior change, potential messengers, and media channels. The outcome of this step is a clear articulation of the single overarching communication outcome, or SOCO. A SOCO is the change one wants to see as a result of the communication intervention. In the context of tobacco control policy change, there are a range of potential audience segments. Primary audience segments include people with authority to create or change a policy. For example, national and local chief executives, heads of agencies, legislators or parliamentarians, and other influential government officials. Secondary audience segments refer to individuals, groups, or organizations that can actively influence policymakers or policy making. Community leaders, experts, media, development organizations, families, and civil society organizations are part of this list. A thorough understanding of the underlying context or situation and intended audiences can help clarify how strategic communication can support the policy change process. For example, taxation is an effective approach to decreasing demand for tobacco products. Increasing taxes is a common tobacco control policy change objective. There are several possible communication outcomes given this policy change objective. But for purposes of illustration, let us frame our target outcome as follows. An increase in tobacco taxes is supported by the public and at the highest levels of government. The next step in the P process is strategic design. This step is where the strategy is brought to life through messages that resonate with the intended audience, delivered through appropriate channels and communication products, and supported by an implementation plan that is SMART, or specific, measurable, appropriate, realistic, and time-bound, and with clear indicators for monitoring and evaluation of outcomes and impact. The output of Step 2 is a strategic plan for the communication intervention. Following our earlier example on tobacco taxes, our communication objective can be framed as follows. to increase public awareness and support for tobacco taxes by 25% from baseline over the next 24 months. You will see that the objective is closely aligned with our target outcome, is measurable against the baseline, is appropriate for the intended audience, realistic in scope, and takes place within an achievable period of time. When considering the best communication channels to use, it is important to keep in mind that different groups access and consume information in different ways. For example, government leaders and policymakers are usually very sensitive to public sentiment. Sending letters to them written by people whose lives have been affected by tobacco use, presenting public survey data through a video or policy brief, or setting a one-on-one meeting with them to present evidence may be more effective than simply submitting a policy paper. An efficient channel plan typically combines a range of channels and materials, such as print and audiovisual materials, delivered through interpersonal, digital, and mass media channels. A clear timeline of activities is important to ensure organized and seamless implementation. For example, the project could kick off with a public opinion survey in March, with the results publicized in June. The campaign could include sending letters from families affected by tobacco use to policymakers in July, and a series of news programs and media activities between August and November to highlight the benefits of higher tobacco taxes. The monitoring and evaluation plan should track the reach of these different activities and ultimately the change in public support for tobacco control policy change. After building the strategy, the next step is to create and test. This step ensures that communication products, concepts, and ideas resonate with intended audiences and that the messages are clear and actionable. Communication products may be categorized further into two kinds. Limited reach. This includes policy briefs, pamphlets, information sheets, newsletters, and posters. And mass reach, which includes television ads and programs, radio ads and programs, newspaper and magazines, and online content. The choice of materials will depend on the target outcome and intended audiences. Before these products are finalized, it is important that they are first pre-tested among representatives of the intended audience. This is carried out through a combination of research methods, including focus groups, interviews, and surveys. The output of Step 3 would be a package of communication materials. For example, this package may include a policy brief summarizing the public opinion around tobacco control, a set of key messages or talking points for news programs and other media interactions, and multimedia materials such as videos and photographs to accompany the letters from families affected by tobacco use. Step 4 requires you to mobilize support and monitor your interventions. Begin by developing a dissemination plan to reach your different partners and stakeholders. During this step, we can strengthen institutional capacity, foster teamwork among the different groups, and keep everyone motivated and on track towards achieving the desired results. This step is crucial to ensure quality and consistency during implementation of the intervention. Adjustments may be carried out based on the data gathered during monitoring. The output of Step 4 is a set of implementation and monitoring activities that monitor changes in your audiences, reputation, channels, and networks. For example, you may start with organizing an orientation and training for all partners. Afterwards, trained partners can support the implementation of the public opinion survey and share their own insights from the results. Other partners can facilitate networking and media opportunities. The network can also support families, draft and send out letters. It is important to ensure actions are coordinated for quality and consistency, where everyone is moving in the same direction. Finally, the last and final step in the P process is to evaluate and evolve. In this last step, the outcomes are recorded to determine whether the desired change has occurred. This is done through a combination of qualitative and quantitative communication research methods. Combining different methods can facilitate a fuller understanding of the impact of the intervention. Once this is carried out, make sure to share the evaluation results with partners, allies, key stakeholders, the media, and funding agencies. These results will help the design of future phases, programs, or interventions. A thorough evaluation will reveal where the program needs more work, where revisions are needed in the strategy, approach, or materials, and what successes should be replicated. Program staff may have to return to the analysis stage if the situation changes or if new problems emerge that need to be addressed. The output of Step 5 is an implementation evaluation report. In our example, the communication intervention was a success if it was able to increase public awareness and support for tobacco taxation. Such an outcome would help drive the tobacco control policy change process forward. Nevertheless, whether or not the intervention was a success or otherwise, the findings from the evaluation can inform future communication planning. Now this completes the P process. Step 1. Inquire. Step 2. Strategic design. Step 3. Create and test. Step 4. Mobilize and monitor. And Step 5. Evaluate and evolve. In summary, the P process is an effective approach to designing strategic communication interventions to support tobacco control policy change in your country. Strategic communication plays an essential role in advancing the tobacco control agenda. Knowledge, norms, and behavior can all be positively shaped through effective communication.